Hello and welcome. I'm Lisa Feiner. I'm here today with Nancy Weiser. We are both board certified health and wellness coaches. And we're so glad to be doing this presentation for the AAPMD on the collaborative role of health coaches in maintaining optimal health. And I am one of the co-founders of our organization, Sharp Again Naturally, and got into this work because of my work as a health coach and also as a board member of an elder care organization, a facility that takes care of our elders, and seeing how much Alzheimer's and dementia there's been, and my role as a health coach, we just knew that there had to be something causing memory loss. And so that's Sharp Again's mission, is to educate people about what is causing memory loss and what they can do to preserve their memory and also reverse their memory loss.
And I'm Nancy Weiser, and I'm a vice chair of Sharp Again Naturally with Lisa. I have been a health and wellness coach for over 15 years and been delighted to be on the Sharp Again board since late 2016. I specialize in helping clients with all different kinds of health concerns, everything from weight to biometrics and brain health, which of course are all oftentimes connected. Underlying that is working with people to prioritize their self-care in what is generally an overscheduled life. And delighted to be here today talking with the AAPMD and ACAM.
So we want to tell you a little bit about who we are and why we're here. As I mentioned, Nancy and I are board certified health and wellness coaches. We'll tell you a little bit more about that in a minute. And that Sharp Again Naturally is a nonprofit where we started out as an educational nonprofit, and now we have really grown to creating programs that empower people to take the education and put it into practice. And that's what health and wellness coaches do. In addition, we see a world where dementia and Alzheimer's can be prevented, treated, and even reversed. We've seen many cases to date, and where everyone has access to the knowledge, tools, and care to maintain a healthy brain. So let me tell you a little bit about health coaching. It is a profession that in the last few years has really undergone a big change in terms of affiliating with the National Board of Medical Examiners, creating a board certification exam that as of now over 3,000 coaches have passed. And the designation is NBCHWC, which is National Board Certified Health and Wellness Coach. So this profession also has new insurance codes that are being used. They're being demoed right now in the first phase. And I think we will see health coaches becoming a reimbursable kind of expense, and health coaches affiliating more and more with doctors and in many different types of medical practices. So what is the philosophy behind health coaching? I think, first and foremost, we wanted to tell you that we are partners with our clients. It's a client-driven process where clients are self-directed, and it's through their values and what they want to achieve that we work with them to come up with goals that are easy, or at least with support they can attain. We believe in the client's capacity to change, frankly, in everyone's capacity to change if there is a desire to do so. And understanding that clients know themselves better than we as coaches could ever know them. And we are there to ask the questions to get them to use their innate wisdom to help them get where they want to go. And very lastly here, we are respectful and don't judge what we hear. I mean, frankly, we deal with all sorts of clients who, as Nancy said, may have had a history of health issues, um, may have had specific kinds of challenges in their lives. And so we're here really to support them in whatever goals that they have. So why would a practitioner like you or those you know want to work with a health coach? Well, I think these 4 reasons are very compelling. We all know how difficult it is to have enough time with patients. Typically, there's enough time to look at testing, maybe do diagnosis, but in terms of helping clients implement your recommendations, I think most people would say that is something that there just isn't time for. Um, a lot of times, if you, let's say, tell a patient to lose weight or exercise more, because those are not specific enough and not personal enough to them, they don't follow through with those recommendations. It's very difficult for them to know specifically what to do. In addition, we all have our own ways of eating, our own lifestyle habits that we've accumulated over the years. So those things, in fact, may not be that healthy to begin with, or patients may not know how to change those or tweak those in order to attain the results that the doctor is looking for and has asked them to do. And in addition, there's no program. There's nothing for them to follow that they can then have lasting change. The whole role of a health coach is to see whether clients are ready for change, help them through the process, and then also help them in the maintenance phase. So this is a kind of what we call a coaching in action. It sort of gives you an idea of the different types of things that need to be in place for a coaching relationship to be successful. One is to establish a trusting relationship with the coach and the client. And for the coach to really understand not only the client's goals, but we call it the why. Like, what is really motivating them to make the changes that they're there for? You know, for example, if somebody wants to lose weight, so what is their why? Is it because the doctor told them to, or because they're expecting a grandchild and they're 100 pounds overweight and they know that they won't be able to care for that grandchild at the weight that they're at? That's a compelling why. We also, and I mentioned this just a minute ago, determine the client's readiness for change and also to prioritize their health. If a client isn't ready to make changes, there's nothing that the health coach or the doctor, frankly, can do until they get into that mindset. And we can encourage them. We can help them get ready for change. We can talk about the whys, but the client themselves has to be ready. When we start working with clients, we anticipate what the obstacles are going to be, and we do talk to the clients about it. This is a very natural part of the process, and it's ones that doctors often won't really know about or even think about. This is very real for our clients. And so discussing those obstacles up front makes the whole process more apt to be successful. I mentioned that guidance, support, and accountability. Accountability is very important. Sometimes clients just need someone to be there to say, how's it going? What were you able to do this week? Help them celebrate their successes and get back on the horse if they haven't been successful. And this idea of relapse is also built into our process. It's something we expect, or let's say, or at least not surprised at if it happens with our clients. and we are trained to help them work through that. Again, a very different process than just working with a doctor and being told to implement or to take certain steps to be more healthy. So we'd like to just show you these two plates side by side. The one on the left is the one that the government issues to try to help people eat healthy. And I say that kind of in quotes. It's all about the food that's on the plate. And they try to give you an idea about a quarter of what you're eating should be grains, a little less protein, a little bit more vegetables, some fruits in there as well, and dairy kind of on the side. At the Institute for Integrative Nutrition, which is where Nancy and I trained, there is the food that goes on the plate. We call that secondary food. But the primary food in our lives that nourishes us tends to be things like our relationships, the activity, our movement, our career goals, our spirituality. It could be our hobbies, spending time with our grandchildren or our children. It's all those things in life that nourish us. So you'll see here that we also include water as part of this healthy diet and lifestyle. Hydration is so important, and also fats and healthy oils, which we know as health coaches that focus on brain health is critical. So you'll see that the things in life that really are nourishing often do not come on this plate. And these are the kinds of things that health coaches are focusing on with their clients. So this is the how of health coaching. And you'll see we have these three circles that are coming together. So stress, food, and time management. And all of these things need to be within the control of the client in order for them to be able to attain their goals. So this is what the health coach does, is work with them on these three types of issues. And there are others, but these are the primary ones that really can get in the way if they're not being worked on. And these are also the kinds of things that a health coach would work on that a physician probably would never spend time on. So when it comes to coaching clients with memory loss, there are some issues that we really want to make you aware of. Most of us know that whoever our client is, it may not be the only client we're dealing with. If you have somebody who, for example, has subjective cognitive impairment, means that they're just noticing themselves that maybe they're having some forgetfulness or some memory issues, you can probably deal directly with that client in the process of helping them become healthier. But if you have somebody on the dementia continuum who's got mild cognitive impairment, they probably need somebody else who's living in their household. It could be a spouse or an adult child. It could be a caregiver, but someone else who's participating with the client in the health coaching process. And you, in fact, might end up having at least two or maybe more clients in that sense. And it's something that we health coaches have to keep in mind. The next one is motivation and readiness for change. We've talked about that already a little bit, but unless the client themselves are motivated to change, it's, you might have an adult daughter, let's say, who really wants their mom to be less forgetful, to remember her grandchildren, to take steps toward her own health, her own brain health. But if the parent themselves has no interest in it, it's very likely not going to be successful. So that's something that we also will ascertain before we start working with a client. And then compliance, having that other person in the household, if necessary, is very key to making sure that the recommendations that both the physician makes and that the health coach makes are being complied with and follow, and they can follow through. So, many doctors, especially functional medicine doctors who know what it takes to help someone with memory loss, will make sure that there is that support system before they will even take a person on as a patient. So I'm going to turn this over to Nancy now, who's going to take us through an actual client case study. Thanks, Nancy.
Thank you, Lisa. Great introduction, by the way, to everything that we do. So let's meet Harriet. Harriet is currently a client of mine. I've worked with her actually only for just a couple of months, but we've already had a lot that's happened. So here, let's just talk briefly about where she was coming from when I first met her. Harriet is 60 years old. She's 5'2" and weighs 198 pounds. She has insulin resistance. She suffered from hypoglycemia, was diagnosed with that back as a teenager. She's had thyroid cancer, and that was over 20 years ago, and had her thyroid removed and takes Synthroid for that. She previously had endometriosis, and she had a hysterectomy for that, followed by a hemolytic anemia episode at age 40, and she has a stent in one of her 2 kidneys. So where are things currently? Why did Harriet seek out the support of a health coach? First of all, she came to us to Sharp Again Naturally. Originally, I met her through one of our Sharp Again Naturally webinars that she attended. She's an active member of our webinar community. And she knew that she suffered from forgetfulness, and somebody told her about us, and that's how she came to us. At this point, we call this subjective cognitive impairment, meaning that she herself knows that her memory is not what it was, but she's far from any kind of a diagnosis of what would medically be made or a neurologist would make in terms of any kind of dementia. So we call it subjective cognitive impairment. She calls it forgetfulness. She's clearly overweight. She would like to lose 50 pounds. She complains of different kinds of things happening with her joints and her limbs. She has sometimes the shakes. Her hands can get numb and stiff. And she has knee pain that's actually was pretty severe. I'll go into that a little bit more, but pretty severe knee pain to the point where it would wake her up at night. Sleep problems, high cholesterol, mid 200s, does not exercise, and really has no time for self-care, or as I like to say, she's not able to prioritize her self-care yet. It's not that she doesn't have the interest. So I have the obstacles. What was getting in her way? It's not, she is a person who knows, let's say innately sort of knows what she should be doing, but she's not doing it. So here we go. She has really what's in I would say the biggest obstacle to her own self-care is that she has an autistic son who lives at home, and their whole home has been redesigned and oriented around his needs, and the rotating staff of about 15 different professionals who come and go throughout the week and the day, all day long, to care for him in the home. She also has an elderly mother who lives nearby. She is needed 24/7 by all the people in her life, primarily by her son, but other people. She eats standing up and on the run, literally never sits for a meal. She's under stress and constant pressure. Her husband, interestingly, does manage to prioritize his own health. He exercises actually many hours, several hours of the day. She, in addition to her husband and the autistic son and his staff, has an active teen at home who she's still carpooling around and taking to lessons and practices, and another adult child who's newly home, again at age 28 because of COVID. And so that child is actually overweight and addicted to carbs, says my client, who is her mother. So that's a little bit of a situation there. It's constant activity, constant mayhem, constantly needing to feed a whole lot of people, doesn't take any time for herself. Previously, Harriet has been all over getting help for herself. She's seen lots of doctors, conventional integrative doctors and nutritionists, other people as well, but that kind of covers a large part of who she's seen. And again, going to the doctor for a various pain, ache, or discomfort in one area, no one's sort of looking at the whole picture and really, really kind of digging down into the root causes of what's actually getting in her way. This would go to things like looking at something like her thyroid or endometriosis. As far as her son's autism goes, every time she would bring up something about his diet, she was told, it's not the food, he has autism. That was the refrain she was constantly being told. So the visiting many conventional doctors and specialists was both for herself and for her son. So she's been everywhere that you see there. Enter the health coach. So some of you might have seen this cartoon we lifted for this. It used to say psychiatry help 5 cents. So we're not a psychiatrist, we're a health coach. So the concept is the same. We are here for you. And there you have it. Okay. So what's the situation overall? Harriet is a cooperative client. She wants in on what is going to make her feel well, but she, in her own words, doesn't know how to make it happen. So the first thing we do is we talk about goals so that the client understands that it's their goals. It's not my goals or Lisa's goals or somebody else that they're living with. It's not their goals. It has to be the goal of the client themselves. And to paraphrase, she needs to be here for a long time to come to take care of her son. That's who she is and what she does. So in terms of that, and also the other people in her family, being the best version of herself is what is her goal. And that's going to mean at this point, when we talk about the goals, I've usually had one initial session with the client. So now we're in the first session of what will be their coaching program. So crowding out foods that do not support her health or her son's health. Walking 20 minutes a day is something she'd like to do, but is not there. And then spending time engaged in what I either call health supportive activities or just simply self-care. Short breathing exercises, becoming educated in an easy way, like watching health-related movies and getting on a much better sleep schedule. I've been very, very clear with her that she is not likely to lose weight until she gets sleep in line, which will get in line for her hormones that will support her appetite and her ability to lose weight. The coaching plan includes all of these things, not all at once, a little bit at a time. We start with the food. I start with the food, and I'll elaborate more on each one of these. It's not just, food is too broad of a category, but you'll see more later. I don't want to repeat myself over and over. Movement, time management, importantly, to include the self-care and include things like breaking down, the getting of a meal on the table into 7 smaller baby steps, not to be done all at once. I know for the people who arrive at the table just to eat, it looks like you just threw a meal on the table, but breaking it down into these 7 component parts and scheduling them. When do I plan? When do I shop? When do I prep? When do I cook? When is the serving of the food, etc. Sleep, getting that sleep schedule again has to be something that is what I call calendarized. Communication and setting boundaries. Lisa and I actually discussed before the presentation, is this specific to Harriet? And I said, absolutely not. It seems that most people do have the disease to please, or many, the large percentage of people have this. And so getting clear around setting boundaries enough that you can take care of yourself and communicating that effectively with the people who you live with, work for, etc., is actually something that, that can use some coaching normally. Stress reduction, we'll talk about some formal techniques for that. And again, I mentioned education with the movies, and it also will probably be a book here and there or an article that I send out, and I'll talk more about what that means specifically. But these are kind of the components of everything that we look at. Initial treatment. So I said I would talk more specifically about food, so here I go. Dietary changes, what to get rid of. Processed and refined carbohydrates, including sugar. So I just said to Harriet on our last coaching session, I said, anything made with any kind of flour, that means that it's processed. It didn't start out that way when it was whatever it was in the field where it grew. So nothing made with flour makes it sort of easier. No powdered foods, flour, sugar, even protein powder for your shakes. No gluten, Dairy, including, including flavored yogurt, because a lot of people think yogurt is fine, but flavored yogurts all contain a lot of sugar, as many of you know. Beans and grains, this would be for people who are really looking to, be going more toward a ketogenic diet, to really focusing on blood sugar and keeping it stabilized, because we don't want that blood sugar to lead to insulin resistance and having, what we call type 3 diabetes, which can result, is now equated with dementia. So this also means no gluten-free processed foods, which can be a big aha moment for people who think, well, I'm gluten-free. I say, yeah, but if you're having the gluten-free bagel and the gluten-free whatever it is, you are having a lot of things that have no fiber and have no other nutritional properties that are going to give you a lot of the micronutrients you need. So tapioca starch, potato flour, potato rice, all those kinds of things, they can lead to more of a pre-diabetic or diabetic situation. And they can also lead to constipation, no fun. So for Harriet, no nightshades. Remember, she had all those issues with her hands and her knees, no nightshades and no alcohol.
So what are the nightshade vegetables, Nancy?
Oh, I'm sorry. Okay, so I like to say that I can sort of rhyme them, because they are tomato, potato, eggplant, and pepper. And a sweet potato is not what I'm talking about. We can call that a yam for now. So regular white potatoes. And when I say peppers, I don't mean the black pepper you put on your food that you grind, but I do mean all kinds of anything coming from a bell pepper. Any kind of serrano, sriracha, whatever they're called, any kind of paprika, anything that is in the pepper family, along with eggplant, tomato, and potato.
Thanks.
Sure. What to eat. So this is what we're emphasizing here, what are called nutrient-dense foods. So this means, where are you getting the most power-packed amount of nutrients for the least calories? So you can think best case scenario when you'd eat leafy greens, kale, and blueberries like all day long. Of course, we're not going to do that, but that would be the most nutrient-dense foods you could eat, because they're just packed with so many vitamins, nutrients, antioxidants, phytochemicals, with very few calories. So that's sort of the goal, but also, of course, combining it with good fats. So low processed sugar and carb, reading from left to right. Talked about that a little on the opposite page, on the previous page. Healthy fats are really emphasize what we call the smash fish. Lisa, you don't have to ask me what they are. I'll just tell you. They are salmon, mackerel, anchovies, sardines, and herring. So all of these come in jars and cans that you can get in the store and just pop open for lunch every day. Really easy, really super easy. So that's a nice thing. And they have when I say healthy fats, I'm really referring to omega-3 fats, the fats that will keep the cell walls lubricated for the insulin to be able to push through and dump the glucose off on the other side of the cell wall where the body can use it for energy. So I talk about this with clients so they can get a clear visual in their head of why are they eating the smashed fish? Why do they have to take 10 bites over 10 days to acquire a taste for something that many people will tell me they do not like? I'm saying this is why. You are preventing insulin resistance. You are feeding your brain the kind of fat that nurtures your brain. Vegetables, especially leafy greens and crucifers, kale, everything in that family, collard greens, dandelion greens, crucifers, broccoli, cabbage, cauliflower, did I say that? All those Brussels sprouts, all those things, all the things from the allium family, garlic, onions, and leeks, and a few nuts and seeds. Not too many because they're very calorie dense, but enough. Few there, so you can round things out. Now, sometimes this can look a little bit different. If the person is not significantly overweight, is not necessarily insulin resistant, or talking about brain health, some people will be able to add in some whole grains. If you are not in that situation, and let's say you're a very vigorous exerciser, whole grains may fit in with your repertoire. But for this kind of a case, I take whole grains off the slide and I put the nuts and seeds in instead. So the initial treatment was how to eat. And what I often say, and this is really important, is how you eat and where you eat can be more important than what you eat. And this is another general aha moment for people. Giving Harriet a greater awareness of what she's eating with respect to how it reacts in her body, whether it's about digestion, energy, or mood. Sitting down and chewing her food, two totally new concepts. She literally said to me, she didn't even know she was supposed to chew her food. She didn't make this up. She said she just thought she had to get it down. And I had to explain how the chewing mechanism itself is designed to bring saliva into the food, mix it with certain enzymes like amylase, so that it would be easier for that food to, when it goes down the tube there into your gut, for the microbes inside the gut to be able to pull the nutrition out of the food that she works so hard to chop, and saute, and be able to utilize the nutrients. Without chewing, really hard for the body to do that. Total aha moment for her. The awareness, I mentioned this briefly before, the awareness of the steps to get meals prepared and or get help doing it from whomever. I said, it's either you, your spouse, your grown children, or somebody you hire, or some combination, but it has to be known who is doing it and when each step is happening. I always recommend not shopping and unpacking on a day when you're prepping and or cooking. It's just too much. It means you need to have a leftover meal to have the day that you shop. Another like, wow, light bulb goes off. And then the eating is in there because we talked about the chewing and the eating and the sitting down, is if you haven't planned for that, you end up eating on the run and not chewing. So the biggest meal is that it should be at midday, and a smaller meal, which we call supper, from the French souper. And that's, again, we're talking about an inverted pyramid. Yes, inverted pyramid. Try to get most of the food in the earlier part of the day, and that way you have all afternoon to burn it off, as opposed to eating it at night and letting it sit there. Persistent, consistent hydration. Here we go, here's my water. So you can start the day with a couple of cups of water, and then throughout the day, you're kind of having maybe 4 ounces at a time, all throughout the day. We're not trying to create any bathroom emergencies, just an overall environment in your body of hydration. Okay, more on food, because we've got the eating environment. Okay, this comes up for everybody. I don't care who you are, unless even in times of COVID. What do you do when you're going out? What do you do if you don't have control over the situation? Whether it's to a relative's house or a sporting event or a school event, so you can eat before you go. That's how you can do it. You can eat before you go and say, you know what, I'm not really going to this event to eat. I'm going to support my kid or celebrate somebody's event. I'm going to be with the person or the people for either the content or the company. I'm really not going for the food. So you can eat before you go. You can bring a little of your own food. When I had young kids and I went to birthday parties where it was all pizza and juice boxes, I always had an apple and nuts in my bag. And of course, my water. Or don't go. Yeah, you have a choice. You don't have to go if you think this is going to be completely something out of your control. So this is a way of bringing control, starting to bring the control back to Harriet. Also, what's important that's not on the slide is to enforce with family not to bring junk and processed food into the home. This is something she and I are actively working on right now. Not even for birthdays. So she just told me she's got relatives coming over and she had to tell them, no, don't bring the ice cream cake. She will have everything there that she wants everybody in her house to be eating. So that's where remember those two, the icon with the two little people talking to each other, that's where the communication and the setting boundaries and the coaching comes in around a situation like that. That's very specific to her in the situation that she's in today. So what were the ripple effects of the changes that are happening here? So Harriet was very clear to me that her son's health and his behavior in their home is not only her #1 priority, but it is her life. And as her coach, I have no judgment around that, as Lisa alluded to earlier. But not only that, I'm here to fully support her in what is her life, as defined by her, not by me, right? So her son's behavior affects her ability to prioritize her own self-care. So this is a hard situation. We have to sort of be working under the guise of you'll be able to help him more if you're actually not there for him 24/7, but you take some of the time for yourself to be your best self. What has she done for him? So she said to me, we're going to start with him and then move to me, which was not necessarily the plan when she first signed up. So we morphed into whatever she wanted. She eliminated, this is for him, tons of beans and fruit. Okay, she also realized, and she charts his behaviors that his behaviors were significantly improved once she realized that eating quinoa 3 times a day was having an adverse effect on his behavior. And his behavior is really bad when I say adverse behavior. He lost 11 pounds in maybe a 3-4 week period. His bloating is gone and he has fewer outbursts. And guess what? Everyone is noticing. Her husband, the rest of her family, and all of the staff that supports, I would call her work with him at home. So let's talk about her progress. This is about food and health. So right away, her digestion improved tremendously. And again, I'm explaining concepts to her like the microbiome and eating to support the gut wall and being very clear and specific around that. Even though, quinoa is a whole food and it's healthy or health supportive in some ways, it wasn't particularly helping with her or her son's digestive issues or the insulin aspect of things. She's lost weight. This last one was a real surprise to her. Her knee pain, which had been keeping her up at night, like waking her up at night, is completely gone. So I feel great about that. Her sleep is therefore improved. She's not eating any sugar, carbs, processed foods, or now grains. She can go longer between meals because we've added a lot of healthy fats that allows her for satiety to go longer. And she's working out with a trainer. Just for 10 minutes, but it's a start. So remember we talked about the Venn diagram was food, time management, and stress. So that's what we're kind of following along with here. So if you remember that, and her goals are in the middle. So what do we do? Well, we got her some computer to support to be able to sync the calendars from her multiple devices. So she wouldn't be over scheduling, double scheduling, or kind of having a general sense of, I don't know what's happening. And I say, once that's done, you're going to get a lot more clarity about what is happening in your day. And then once that's done, we can start to do what I call making an appointment with yourself for anything. That could be for appointments that she has with other people, but more importantly, things like the self-care tasks, the walking, maybe something like using a dry brush before the shower, something that she'll be doing with her son, whatever it is that she wants to do, but making those appointments now so she can see how the rest of everything falls out around the self-care. Setting boundaries with professionals to align with her family priorities and schedule. So what do I mean by that? Again, I talked about she has a big staff coming to support her work with her son. And often, like, for example, she had one person who was coming on a particular day from 5:30 to 7:30. And we're trying to get the son specifically on a regular meal schedule. I said, well, that's not going to ever work with dinner. And when the bath time is, like, none of that's going to work. So and she said, well, suddenly the person who says they can only come at this time can come at another time. So this is what I mean about getting clear with the boundaries and being able to communicate with the professionals or anybody else. It's your time to be able to say how you want to spend it when people come. Prep ahead, this is the food, and batch cook to eat an earlier dinner. So her family was saying, we're not helping you at 9 o'clock at night. We want to relax and watch TV then. I said, that's totally reasonable to me. That's not actually the time to do it. Perhaps on Sundays, you have a big family cook-off where for an hour, everybody chops vegetables. Now you have 5 hours of chopping done versus you're trying to get that done during the week. Ziploc bag, set to go for during the week. Establish a daily routine and keep the times consistent. So that's what I meant by the bath time and the meal times for her son and really for her too. Stress reduction. So third wheel of the Venn diagram. I did food, I did time management. This is stress reduction and education I'm going to add as part of her self-care routine. So having a menu of options with varying lengths of time. So I have a 1-minute breathing exercise. I have an 11-minute YouTube meditation that I send her the links for. I'm suggesting because she is not accustomed to doing yoga, or any activity, that she start out with a private yoga instructor for a couple of sessions at home or by Zoom or whatever, to get going with that. So she can then just follow along with any old Zoom class, of which there are thousands now since COVID. Education, movies. This is what I supply to her. Recipes, curriculum handouts with each session. So before each session, I send 4, 5, 6 different handouts, usually 1 page, page and a half, things that we'll talk about in the session or not. If what she wants to talk about is what she wants to talk about, I go along with that. She leads the session. And these can be sort of a backdrop of things that she can read later. Or sometimes I'll say, you know what, one of those handouts we really need to talk about. And somehow it has to everything to do with what we just talked about. It just happens that way. At least you know what I'm talking about. The universe aligns. And occasionally there'll be some books. So what's the result? Harriet is feeling a bit more in control, which means she is less stressed. The calendar management is putting her more in control of her time. It's not even the ability, I want to just say she's felt joy from being able to improve her son's diet and watching his digestion, weight, and behavior all change for the better, which is increasing her own sense of confidence and self-esteem, which is great, her sense of self. She has more time for self-care. We're not done yet. She's got a long way to go, but it's happening. And the seeds have been planted. And guess what? The forgetfulness that she originally approached us about, came to Sharp Again with, came to me about, is now improving. Coaching in action. So this is a little bit about the how and the why of why these things work and sort of some level of depth of an explanation of what I go into with my clients. So if you just say, and again, this is where we really can be supportive and collaborative with the other healthcare professionals. So most healthcare professionals seeing an overweight woman with some of the issues she had would say the same things I'm saying. Eat fewer carbs or just lose weight and exercise are the general recommendations. The person has to really understand how this all ties together. I'm about to give you some of my secret sauce. So if we say go for a 20-minute walk, it's not to burn calories or to somehow magically burn this fat off of your body. It doesn't work that way. Because if you go for a 20-minute walk, you will be hungrier and you will eat back those calories all the time, sometimes even more than you burned off. But what the walk is doing is it's tiring out the body so that the body puts itself to sleep. So it's not another source of stress where you're saying, I can't sleep, I have to count sheep, I have to find some kind of artificial way to make myself feel like sleeping. If you exercise, it takes care of itself. You don't have to mentally try to put yourself to sleep. But what happens is when you took the 20-minute walk, you tired out the body, I'm going through the cubes here, the boxes, and you got better sleep. There are two hormones. Leptin, which a lot of you all probably know this obviously, leptin is the appetite hormone. So when the more you sleep, the more leptin or the fullness hormone goes up. So more sleep, more fullness, and less ghrelin, the hunger hormone. So it's a double whammy. Less sleep, you get less full and more hungry. These two hormones go the other way. And then I explained that intuitively this of course makes sense because if you're not well rested and you don't have energy from your sleep, where's the only other place you can get it from? Your food or a cup of coffee, which is not going to be helpful either. So this then helps balance weight, energy, and mood. And so what I say to Harriet and clients is before you're going to eat, you want to think to yourself, how will this affect me in body, digestion, sleep, skin, all of that? Energy, am I going to kind of go up and down in the sugar roller coaster? And mood, what am I going to feel like? So the cupcake might taste delicious right now. It might until you get used to not eating it. But how's that going to feel in an hour, tonight, and the next day? And all of this helps to detoxify the brain and improve forgetfulness. So improving the forgetfulness is really almost a side effect from everything else that we're doing. Okay, so recommended medical support. We want updates on HbA1c, insulin, fasting glucose. She already voiced that her last cholesterol test was not so favorable, and markers of inflammation like C-reactive protein and homocysteine to find out are we being successful here? What are the measurements? How are they looking? And usually clients will come back and say that the doctor will say, what are you doing? Keep doing it, along with weight and blood pressure. So here's sort of like the moral of the story of this whole case that we've looked at together now. Harriet came to us because of forgetfulness and approached Sharp Again Naturally as an organization to get educated and maybe get a little support, found her way to me through the organization. But what she really needed was help with her son and setting boundaries and prioritizing in her life in order to then be able to then even access the recommendations that a doctor or I or anybody else would give her.
Wow, Nancy, this has been incredible to take us through this case study and to show really what health coaches can do in action. So thank you so much for that.
Thank you.
So we just wanted to take a few minutes and just say that health coaches have really been the driving force behind Sharp Again Naturally. We have 6 health coaches that work with us regularly. 5 are board members, and we have 1 who's a volunteer. And it's really because of the health coaches that we moved from simply educating the public about the causes of memory loss to helping them get better, improve their memory. We have some small groups, which I'll tell you about. And it's the health coaches who can feel the inquiries that come in from the public and the medical community. People like Nancy and me, and we have the other health coaches can make presentations and speak really from experience on their own clients and how they're helping them and the changes that they see taking place. It's very inspiring, actually. And so because of that, our mission has expanded. The whole landscape really is changing around the brain, neuroplasticity, understanding that some of the things Nancy talked about today, even with Harriet, can impact the brain and the hippocampus, not only the size, but also the functioning of the neurons and the signaling. So it's very, very exciting. And this continues to change as more research is done. And we work with many people seeking help for memory issues. So it could be on a whole continuum, really, of people who just come to the website looking for some information. And our website is being totally upgraded. Hopefully in the next couple months, we'll have a brand new website with easier navigation and everything else, to people working one-on-one with health coaches. So it's a very exciting time for us. Our programs include the webinars that Nancy talked about, which is how people often come to us, and then they hear about the small group programs that we started this year in 2020. It was kind of synchronistic that we were planning to do these virtual groups during this time of COVID, and also at a time when people really do need support around so many issues. So our small group programs really are just 5 or 6 people working with health coaches to establish goals and learn about what might be getting in the way of their having a better memory, and then taking steps to improve that. We also have plans to create a professional referral directory on our website. That will be part of the new website. So we will be building that. And if you as a practitioner treat any of the causes of memory loss, if you do functional medicine, if you're a naturopath or a homeopath or
a health coach,
or a health coach, yes, we will be building this directory, and we would love to hear from you. And you can write to us at info@sharpagain.org. Nancy and I can be reached at the following email addresses. And again, our website is sharpagain.org. So we really thank you for tuning in today and learning more about how health coaches and practitioners can collaborate. And you will be seeing a lot more of this type of collaboration, I think, in the future. There's no doubt about that, really. I think health coaches are here to really work with and help support the medical interventions that we're seeing the client and the patient getting in the medical community. And the idea is to collaborate and to work together. Nancy, do you have any kind of final words?
No, I think that pretty much says it all. It has to be a real partnership to be able to make it happen at home where people are living, especially now. So it's a complete package. It's a real marriage.
Well, thank you very much. And we hope you enjoy the rest of the programs.